What's up, everybody? I'm Dr. Bryan Brozy, B.Well Physical Therapy and Wellness, co-host of the Well Man's podcast. Today, I'm going to be demonstrating a side plank to you or a side plank modification. Super important for developing core stability and strength. Again, this is one of those exercises where it's not going to look like we're doing a whole lot when just looking at the exercise, but if we're doing it correctly, we're engaging our core appropriately, we're going to be working very hard. One thing I like to kind of remind everyone here, I love the cue, sucking our belly button in and up to help engage our TA, but I also want to add on top of that, feeling like we are bracing the whole core. So with that, one cue that works for me is thinking that someone's going to punch me or tap or poke into the sides of my belly, all around basically my low back region, from back to front. I really want to keep this nice and tight. I recommend the most basic or best starting point is in this bent knee position. We're going to be on our knees, so it's going to be a little bit easier. As far as alignment goes, when I'm actually in the position, I want a nice straight line between my knees, hips, chest, shoulders, neck. I also want my elbow directly underneath my shoulders, so I don't look like this, or I'm not here. And again, nice straight line between my whole body. To start, first and foremost, I'm going to brace my core. I'm going to squeeze my butt, my glutes together to shoot my hips forward and be in this nice straight line and posture, making sure my elbow's right under my shoulder. I'm going to squeeze my belly button in and up, really tighten my whole core, particularly this left side or the side that's having to hold me up, right? And I'm maintaining my butt squeeze with that. So I'm in a nice straight line. I'm going to hold. Again, I'm trying to brace my whole core as if someone was going to poke me all throughout here. Nice and tight, taking deep breaths into my belly still, but trying to maintain that tightness. And I recommend holding this position 6, 8, or 10 seconds to start, and that would have been 1 rep. I'm going to do 1 more without speaking, then I'll do 2 more, and you can see my neutral alignment from hopefully the top. As far as this top hand goes, you can rest however you feel more comfortable. Sometimes I'm honestly giving myself little taps or pokes to try and maintain that tightness throughout my whole core. I also don't want to fold in or too far out, and I'm maintaining my glute squeeze throughout. So I'm going to assume that was about 10 seconds. Come back down. Really trying to lift my hips up, squeeze my butt forward. I'm gonna do 1 more. And one other thing to note, particularly if you have back pain, we want to rest in a nice neutral posture. So if you're resting 10, 20 seconds between, we'll get a little bit more straighter, just like I was in that initial lift when I'm in the position versus here where I've got some twisting going on in my spine. So keeping everything nice and aligned when we're taking a little bit longer prolonged rest breaks, especially if you have back pain. Again, my name is Dr. Bryan Brozy, physical therapist, B.Well Physical Therapy and Wellness, and I'm also the co-host of the Well Man's podcast. Until next time, be well.